Today I'm going to be going over the procedural steps for an enteral feeding tube insertion. First, you're always going to make sure that you have suctioning available. You're going to make sure the patient's bed is in the half hours position. Then, using a pen light, you are going to inspect the patient's nasal passages. Once you find that it's clear, you are going to use a cotton tip applicator to apply antiseptic gel to the patient's nares. Then, you are going to place a bath towel over the patient's chest. Then have the patient hold in the meatless basin and 1 cup of water with a straw. Then you are going to assess the gag reflex by placing the tongue blade against the uvula. Then you're going to make sure the patient is comfortable communicating during the procedure, and this is very important. Next, you are going to measure the length of insertion and mark it with a permanent marker or tape. Then you are going to insert the tip of the applicator into a lubricant. Next, you're going to instruct the patient to breathe deeply and apply their chin to their chest. Then you are going to insert the tube into the patient's nares slowly. Then you are going to continue to advance as the patient swallows, and advancing each time until you reach the level marked for insertion. If you meet any resistance, such as gagging, coughing, or a change in vital signs, you need to withdraw and then resume once that resistance problem resolves. Then, after you've reached the correct level insertion, you are going to inspect the patient's throat using a pen light and a tongue blade. Then you are going to use a skin adhesive to anchor the tube to the patient's nares. Then you are going to auscultate for breath sounds, and then using a syringe you are going to withdraw gastric contents and assess the aspirate and assess the pH. Then you are going to mark the tip of the tube right next to the patient's nares. Then you are going to make sure you affix the tube to the gown. And after this procedure, you're always going to make sure that the patient's bed is above 30 degrees. And directly after this procedure, you're going to want to obtain an x-ray. Thank you.